My name is Katie. I am here with Death Care Coach. I am a death coach and I really provide holistic, non medical support to anyone with a serious illness or a terminal illness and their families. My background, I'm also a nurse practitioner. And I just want to disclaimer myself right here that this is not, we're not doing this live Q&A as medical advice. I am not giving medical advice. I do not provide medical advice here. This is really for educational and informational purposes only. So I just have to be really clear, and I have to put that disclaimer out there that I'm not giving or offering any sort of medical advice. Please, please, please refer to your healthcare provider for medical and health related advice. So how do you prepare for the last weeks of life and really what to expect? So that was one of the questions that I had recently. And when you've never gone through this sort of experience before, if you've never gone through the dying process with someone or have cared for someone who is dying and going through the end of life journey, then a really important thing to know is when that person is reaching really their last weeks of life. And this is different. Timing is really different for everyone because everyone's different. Sometimes these things happen quickly. Sometimes they happen very slowly, but typically in the last 2 weeks or less of life, the dying person is going to need more and more help, whether they need help getting out of bed, whether they can't get out of bed anymore, and you're helping them turn in bed. The dying person really is going to lose the ability to slowly care for themselves. Usually you start to see this about 2 weeks or so before someone dies. Sometimes it's earlier than that, and sometimes it's only days before someone dies. But typically the person is going to need really all of their needs cared for. So that means they'll be needing to be changed, they'll needing to be bathed, they'll need to be dressed, they'll need to be turned and repositioned. They need to be cared for if they have a bowel movement, or if they go to the bathroom and they're not awake and alert enough to actually get to the toilet. It's almost like, the way that I explain it is, it's almost like caring for a newborn baby, but this time a person is at the end of their life. And so you're really providing all of their care needs. And so knowing that ahead of time, that you can start to prepare if you're going to be the one really caring for your person, to know that you're going to be the one really providing all of their physical care needs. So that's one of the questions that I had recently is how to prepare really for those last few weeks of life, and what really happens. Typically, the person is going to be losing slowly in the last 2 weeks of life, losing lucidity, probably sleeping a lot more, less awake, less alert, less lucid, less conversational. And at a certain point, they will really become sort of in this unconscious state of mind. And so they're really not going to wake up anymore. Typically, that happens in the last days of life. Sometimes you may have heard of an end of life rally. A rally is when a person appears to be in this deep sleep state. They're not awake, they're not alert, they're not eating, they're not drinking, and it looks like they're probably nearing their time of death. However, all of a sudden, sort of out of nowhere, they wake up and they start eating, or asking for food, or asking for something to drink, or asking to see people, having conversations with you. They have this sort of like burst of energy, or this sort of surge of energy. It's called an end of life rally, and it's very common when someone is dying. We don't really know why it happens, but it is a common sort of phenomenon that does occur. Sometimes after that first rally, someone might die within a day or a few days after that. And sometimes it's several days. Sometimes people end up having multiple rallies where they go back to sleep, and they start to appear like they're in this deep sleep state, and then they wake up again. And it's almost like they're repeating sort of parts of the dying process, the later stages of the dying process, over and over again after each rally. That can be really confusing, I think, for a lot of people, a lot of families. I think something to just think about and remember is that we can't control their timing. This is their journey, and I think as much as we want to have that control or like want to have that knowing, I think that knowing or awareness kind of gives us that feeling of control. But we this isn't something to control. This is your person's journey, and there might be something that they just haven't completed yet. They haven't finalized yet. They haven't come to terms with yet. Something that they might be working through or wanting to do or say, and they just aren't ready yet. And so it's allowing them to really take their journey in their time. And all right, Adam, here we go. Let's see. Let me read this here. That's a really good question. Okay. So, what if you are living far away and you are not you're not taking care of the person, you're not the caregiver? At what point do you drop everything to go see them? That's a great question. So, I f- this is actually a really difficult question to answer. I feel like it is very personal. Um, hmm. If I'm going to put it in my case, if it was my loved one, let's say, and I was far away, I would um, I would make sure that I go. Whether we had whether we think we have months left with our loved one, or whether we think we have weeks, or whether we think we have days, I think that I would go personally. So I really think that's a personal choice. I think that we have to be careful that time is limited, or we have to be aware that time is really limited, um, and what are all the things that you have to say or want to say to your person, and I think it's if you feel called to go, then I think that's really when the time to go is. I know that doesn't really answer your question. I think it's a very personal question. Um, I can definitely understand, and Adam, you can elaborate here too. But if it's thought that your person might have months left, and you're maybe working far away, and you have a family far away, and you have to get back to that family and work situation. Um, I don't know if this kind of helps answer this question, but I think as soon as I find out, I would go. That's just a personal thought, and I think it would be something that would be like an ongoing conversation that you would have with the person who is caring for them, and uh, the hospice care team who is taking care of them, to kind of give you updates on how much time they think is left. That is something that hospice tends to do, and they tend to do it pretty well. I think when you're around and seeing people who are dying every day, hospice has this sort of intuitive knowing. They just know the dying process really well, and they're able to kind of pick and see with individual people how close they are to actively dying, which is really the last days of life. So I think it would be just an ongoing conversation to have with both the family or caretakers who are taking care of your person, Adam, and also figuring out what is their care team, their healthcare team, whether it's hospice or palliative care, whoever it is, what are they saying as well. I hope that also helps. Eric, thanks for being here. Okay, let me read your question here. Is rolling someone on their side detrimental during the death rattle? My father passed minutes after rolling him on his side. Great question. Actually, the suggestion that hospice will typically give to help kind of ease that sound is to actually turn them on their side. So I personally have never experienced any sort of, from all the training that I have, I don't see that turning the person would cause them to die. It's actually a recommended thing typically from hospice. Hospice is really training families to turn the dying person on their side if they're experiencing that death rattle, to lessen that noise, to make it sort of easier for air to pass without it kind of going over the collection of secretions there. Great question. I would say too, just to add on there, Eric, um, as I'm reading that question, I'm feeling this. Uh, what do I want to say here? I'm feeling like, so I think it's really common to like find something, like find a reason for that timing of their death, of someone's death. And I think that when it comes to someone dying, I don't think that if they're going through the natural dying process, it's really their timing. And it just so happened that you turned your father and he died right after that. I don't think that it's correlation, like causation doesn't cause correlation. It really is just that was time. Um, we oftentimes see that with medications too. There's always kind of like a last dose of a medication, and sometimes it just happens to be right before someone dies. Um, but again, I would say, it's causation doesn't, uh, correlation doesn't cause causation. I hope that helps. I'll say one more thing too here. So with the death rattle, we know that when we are hearing that noise, good, yeah, yeah, yeah. It wasn't. It was. I mean, I wasn't there, but when it comes to the natural dying process, I really it's their timing. The death rattle really is an imminent sign of death, so it's just a matter of when, whether it's seconds, whether it's minutes, whether it's hours. That rattle can last for hours. It can last for days. Sometimes it's barely even there, and it's yeah. I hear it a lot of, did I cause their death? And it was just their timing, and it just happened to be that happened. Would there be a sense of drowning during the death rattle? No. Really common misconception, actually. So what happens with that rattling noise? So we call them secretions, but basically it's like saliva. So our mouth is constantly, making saliva. And when someone is dying, they lose the ability to swallow. And so what happens is it starts to kind of collect here in sort of like the upper airway. And every breath that you hear, every time they take a breath, that air is really just kind of going up and over that collection of secretions of saliva, basically. And so it's really mostly uncomfortable for us to hear. It really is very hard for us to hear, but it is as a natural part of the dying process. It is when someone is really in their unconscious really state of mind. They're not really like in their body anymore, and it's just this air really passing over this collection here. So it's not drowning. Drowning would really be like fluid in the lungs, where the lungs fill up with fluid. This is really just like a collection of saliva that kind of sits in the upper airway. No, it's okay. Good questions. Good questions. Why people's eyes would start to roll back. You know, I have seen why. I actually have no idea why eyes would roll back or forward or whatever direction they kind of move. I've seen eyes do all sorts of things when people are dying. I don't know of any research out there that really explains why. I can tell you oftentimes why eyes won't close necessarily, and that's really because it takes muscles. It takes actually muscle use to actually close the eyes fully. And so when someone is dying, they lose that sort of muscle ability. So the eyelids oftentimes stay open, and why the eyes kind of roll or do different things, I can't really say. Um, yeah, I can't really say actually. So there is one thing actually that I want to just add here, and then Rhonda, I'll read your question too. Rhonda, thanks for being here. Um, Eric, I'm curious if this was like just before death, or if it was sort of hours or days before that you noticed the eyes rolling. Oftentimes, so there's actually, we have studies now, some brain scans basically that show us like the areas of the brain that light up just before death, and the areas of the brain are all associated with the same sort of dream state that someone's in. So like when we're dreaming, those same areas light up when right before death. So it is pretty interesting to me. It's like the areas of memory, just minutes, seconds. Yeah. So I'm actually, I don't know. I can't say this is it, but we do have studies that show that, like, right at that moment of death, those areas of the brain light up, and it could be just this, like, sort of the eyes reacting to the dream state. Who knows? But good question. Sort of like a nerve reaction could be. Rhonda, let me read your question here. So, is an increase in hallucinations a sign that death may be approaching? So, that is a good question. I have a follow up question to that. Are these hallucinations, are they about seeing people or pets or someone who has maybe died before them? Or are they hallucinations such as, like, more of like delusions, like believing that someone's after them or something like that, or bugs crawling or things like that? I'll just, while I'm waiting for you, Rhonda, or to kind of get a little bit more like delusions. Okay, and is it related? So, have these illusions been going on prior for a long time? Or are they kind of newer? I know there's a slight delay on the chat. That's so that I can kind of keep up with everybody. So I'll just kind of talk a little bit here. So, um, it is very common, for people to experience hallucinations, delusions, confusion, things like that at the end of life. Sometimes they're not always associated with the dying process. Sometimes they're associated with the disease. Sometimes that means if the hallucinations are getting worse and the disease is worsening, it could be that this is, a sign that death is nearing. But I would be looking for other things. I wouldn't just be looking at hallucinations and delusions. I'd be looking for sort of other signs as well to make me think that death is approaching. I also would question, are they on a new medication? Any new medications that would cause like an increase in hallucinations or delusions? Sometimes medications can do that depending on what it is. Oftentimes I think about really the disease and sort of like the disease process, um, and then how it relates to the dying process. Let me keep reading here. Since January, mom believes she is being taken. Okay, no changes in medication. Okay. Um, if there's been no changes in medications and delusions, hallucinations, if these are getting worse, I'm wondering if mom is processing something. Facility at night, she's becoming more distraught. So I'm wondering a couple of things. Um, One, I'm wondering if this sort of delusion is a process of, um, feeling like she is leaving at some point in time. I'm not sure that makes sense, but if she's kind of being taken out of her assisted living facility, I'm wondering if it somehow correlates with the process of knowing that she might be leaving this world or leaving her body at some point, if she might be dying. I don't know if that makes sense, but that might be one. So if there's been no changes in medications, that it might be a sign that she is. She doesn't feel good. Okay. Um, that is also interesting. So it is looking at sort of like the whole picture. No new medications. These sort of like delusions or hallucinations, maybe increasing, then not feeling good. I feel like I want to say that, referring to hospice and saying, what is hospice thinking? Just referring again to the healthcare provider taking care of her, to say what they think. But I would say that it sounds like things might be moving in that direction if she is, already on hospice, and this is sort of the progression of the disease and the dying process. If these The other thing to note about this that I want to actually that I'm catching here is that it's happening at night. So there's something called sundowning. Sundowning is basically when the sun starts to go down. So for some people, this is like actually early afternoon. It's actually not when the sun goes down, but it starts like in the afternoon sometime. Sometimes it's early afternoon. Sometimes it's like smack on like evening time around like 4 to 6. And then sometimes it's even like late at night when people get really confused and have these like hallucinations or delusions, or they start just kind of acting out. Sometimes they get aggressive, sometimes they get combative, sometimes they start kind of like wandering around, like just kind of all out of sorts. And it's called sundowning. It tends to be more common with like neurological diseases, so Alzheimer's, dementias, any of the dementias, Alzheimer's, things like that, vascular dementia, Parkinson's disease, even like maybe an MS as well. So it tends to be more common. Yeah, perfect. You have understanding sundowning. Great. More common sort of like late afternoon, evening. So this could also be related to just a sundowning. The thing about sundowning is that we don't know why it happens. We try to like identify these little triggers to figure out, is there something triggering this confusion, this agitation? But we don't totally know. The things that I think about are things like pain. I think about position, like, is she just uncomfortable? I think about, does she have to go to the bathroom? Like, does she have to pee or poop, or has she peed or pooped and needs to be changed, or something like that? Or maybe she's constipated. So I think of like all different things. Sometimes it has to do with like not seeing enough sort of like daylight during the day. So maybe getting somebody up and seeing the lights, like even just turning on the lights and having light in the room for longer earlier. Sometimes that can help as well. So there's all sorts of different triggers that we try to identify that could also be related, Rhonda. Okay, let me see here. Let me catch up. Let me go back a little bit. Okay, Eric, here we go. Let me read your questions here. My dad had asked constantly about his dad that had died, and also his cousin who had died recently. When told his dad was gone, he had denial that he had just spoke to him. I saw you posted. Here it is, Eric. FYI, this was from a glioblastoma brain tumor. Okay, if that helps anyone going through the same diagnosis. Yeah. Okay. So, Eric, this I'm gonna just kind of start with the saying that he just spoke to him. So there is this phenomenon, Eric, that we can't explain. No one can explain it. I have seen it my entire career. I've been working in healthcare since 2011. I worked in hospice for several years. I am still working with dying people as a death coach. I'm working with families. I have been around death and dying for a long time, and no one can explain this. I've searched and researched. There's actually tons of studies out there now through a few different universities, University of Virginia. I'm blanking on the one. There's one up in the Northeast. I can't remember, but there's huge studies around what are called end of life visions, where when people are dying, they see and can talk to people who have died before them. And it is so real. This is without medications. This is, I know that I see that your dad had a glioblastoma, but I've seen it in every diagnosis. Some people have no real diagnosis that would be affecting their cognitive or sort of like brain ability. And people will see people who have died before them, their parents, their siblings, their friends. They've seen pets. Sometimes people see angels. Sometimes people say that they see something, but they just can't explain what they're seeing. Oftentimes people will have conversations with their loved ones. I can tell you one of the like craziest stories that I can tell you actually is just to kind of like bring this full circle. I was working with a woman with Alzheimer's who was nonverbal. She didn't speak at all. She didn't speak for years. And she was dying. And in her last days of life, she kept staring at this like particular place on the wall and over and over and over again. And all of a sudden, out of nowhere, her husband happened to be at her side. Again, this woman hasn't spoken words in years. And she says to her husband, "Your mother is here with me." And that was it. That was the last words. That was the only words she spoke, last words she spoke. And she died just a few days later. I can actually tell you, even from my personal experience, someone in my family died. I was with them throughout their entire dying process, had no cognitive issues, was not on any medications. This was weeks and weeks before he actually died. And he told me that he was also seeing people who had died before him. It's a phenomenon. We call them end of life visions. We have no idea what it is. We can't explain it, but it does tend to bring the dying person comfort. And in a lot of ways, I think it can hopefully bring us some comfort to just feeling like they feel supported in their journey. And so I think we can hopefully feel, because they feel supported, we can also feel like they're supported, whatever we believe. So I hope that helps. I would say I believe that he probably just had spoken to him, and saw him. I hope that helps, Eric. Yeah, I actually think it's a really special phenomenon, actually. Yeah. Oops, this is cut off a little bit. Yeah. Amazing. It's a phenomenon I don't always see with everyone, but I see it with so many people. And so every time it happens, it brings me so much comfort, because it's like they just feel so comforted by it. I was actually recently with somebody. I'll tell you another story really quickly, but I was recently with somebody who, no one had actually told this gentleman that he was dying, and I had gone in to see him, and he, to me, I walked in and I knew that he was dying almost immediately, and he said to me, "I feel like my body's shutting down. I'm pretty sure that I'm dying, and I think I'm dying soon. And I'm also ready to go. I'm at peace with that." And he told me that followed up with that he kept seeing the reason he knew he was dying so soon, and that he was at peace, was because for the last few nights he had been looking at his door, and he had an angel at his door that would just sit there and be with him, and it brought him so much peace. And he was clear as day, no meds, cognitively intact, awake, alert, oriented, knew exactly where he was, what was happening. I mean, it's amazing, these stories. And when you see this a lot, in when you work in end of life care, it's one of those things that I just, like, I have to believe, because I mean, I don't know, you see it so much, and that's why all these big universities are having all these huge studies about it. So it's pretty amazing. Yeah. Rhonda, I think I see something here. Oh, mom just had her 96th birthday, so I wonder if that might be triggering for at least 6 months. She has told us she's ready to die. Um, Rhonda, it could be. If she's ready, um, I've seen people be mentally ready. Physically, their bodies might not be quite ready. It really is. It's both I've come to believe, at least, that it's really a physical process and like a mental, emotional, spiritual, psychological sort of process. However people kind of believe that process is, whether that's emotional or mental or spiritual. So the body really has to be ready, and the mind has to be ready. And so her mind might be ready, but her body might still be kind of running. And it's one of those things that we have to be patient for. I do think that sometimes we see, after these big events, like a big birthday like this 96, or some other big event. Oftentimes we do kind of see a decline after that, after these big events. So we could be seeing that, these, increases in hallucinations and delusions and not feeling well. This could be sort of like, you're right. It could be that sort of, I don't know if it's trigger or what, but it's this clock of, it's time. I'm glad, Rhonda. Yeah, absolutely. Thank you for all of these questions. Thank you for being here. I'll say this too. So, When so how do I say this? Okay. So when I am sort of like when I'm with people who are dying, there is sort of this like timeline, this general sort of timeline of the natural dying process. So like there is this natural biological sort of like shutting down process that our bodies go through to reach the point of death. Every disease is going to really affect the dying process. Every disease is going to affect how someone dies differently, and everybody's also different. So kind of like I just said, how dying is just not just a physical event, but I really think it's like this mental or emotional or psychological or spiritual sort of event as well. Like someone has to be really mentally ready to die. I've seen people sort of like hold on, like they almost like they fight to stay alive, they fight to stay alive for a certain event, for example, or to see somebody, or to like get all of their affairs in order when you think that they're ready to die. But people have this ability, at least in my experiences, of being able to like hold on, or think that they need to hold on until they realize that they can actually let go, and they can actually let their body do its natural work. Um, and that's a process. I think that really is kind of like a mental, emotional, spiritual, whatever it is for that person process, to be able to get to the point where they allow their body to do its natural sort of thing. Um, And oftentimes you see during the dying process, you'll see like these natural changes. Um, and they can often be very slow. And then all of a sudden there's kind of like this turning point, and all of a sudden someone's physical body really declines very, very quickly. Or the dying process really kind of speeds through the last kind of couple of weeks or couple of days, and it kind of happens really quickly. It's hard to explain. I'm actually struggling to find the right words, but um, it can be a really slow process until it's not. I don't know if that makes any sense, but for me, it's almost like a little intuitive. I look for just like the smallest changes, and almost these like tiny little small changes that start to happen in a short period of time. For me, it kind of triggers me to think, okay, I think something's happening here, and I think we're going to see a bigger sort of decline in a shorter period of time. I don't know if that helps, or if that makes any sense, but just kind of spitballing here. Um, Certain diseases and people dying um, with infections. So, a lot of times, what happens is with certain diseases, the disease itself basically kind of starts to shut down the body's sort of immune system and ability to fight. And so, oftentimes, with certain diseases, I'll say, for example, oftentimes with like dementias, different dementias, with neurological diseases, with really sort of all sorts of diseases, the body's ability to fight off infection becomes very poor when someone is dying and as that disease is progressing. And so, oftentimes, you might see that someone will develop an infection, whether it's a urinary tract infection or whether it's a pneumonia. And we can try, even if someone is on hospice, sometimes the hospice, after different discussions with families, they might suggest trying an antibiotic if that person is able to swallow the medicine, swallow the antibiotic, to try to fight off that infection that is there. What you will oftentimes see is that sometimes it might work for a little bit, or it might try to fight off some of the infection, but it doesn't always. And sometimes, sorry, I'm just getting distracted by reading. I'll get to you, Mary Ellen. Thanks. So sometimes you see that infection kind of get better a little bit, but sometimes that infection comes right back. So you might think that the infection is gone for your person, but then it might come right back, and it makes it even harder to kind of treat it a second time. Oftentimes, you will see that because the body's immune system is just shutting down, even antibiotics can't fix that infection. So I'll give you a quick example. Actually, it's a personal example. I had another person in my family who was dying, and she was having repeated urinary tract infections, repeat. She also had Alzheimer's disease, and her body was just, I mean, she just had no immune system left. We had tried antibiotics for quite some time, and they just didn't work. They were not working, and they weren't going to work. And so she actually ended up dying from her disease, which led to this infection that she wasn't able to fight off. So that can happen. So that was just a quick little story that I wanted to throw out there while we were waiting for questions. Okay, let me see here. So Mary Ellen, thanks so much for being here. So let me see. Great chat. Can you list some of the physical symptoms that death is imminent? Skin color, cap refill, etc. Thank you. Yes, absolutely. So imminent. So I would say this is like the things that you want to look for really in the minutes to hours to maybe days before someone dies. Again, timing can be different for everybody, but these are kind of the things that you might want to look for in a person who is nearing death in the last minutes, hours to days. So one is really that death rattle. You're going to hear, just like Eric was saying before, you're going to hear this rattling or gurgling sound in the back of the person's throat. And really what that is, again, just if you've missed it before, it's just air really kind of moving over this collection of saliva that the person really can't swallow in that sort of upper airway. So I would look for the death rattle or listen for the death rattle. I would also look for changes in breathing. So typically, the dying person, you'll notice the natural change of imminent death is this sort of change in breathing. The person starts to breathe faster and faster and faster and deeper and deeper and deeper. These really big breaths that are really fast, and then they slowly start to slow down. They become shallower and shallower and shallower. And then you notice this long pause. Sometimes that pause between each breath can be 10 seconds, 20 seconds, 30 seconds. It could be 60 seconds. It could be more than that, more than 60 seconds. And then you start to see that breathing pattern again. So it starts out, the breath will get bigger and bigger and bigger, or deeper and deeper, and faster and faster, and then it slows down again and then pause. It's called Cheyne-Stokes respirations. That's really a sign of also imminent death as well. Typically, that's really when we're using morphine to help really lessen like the labor of that breathing, because it can look, when you look at the person, they look like it's really hard on the body. And so we use morphine to help kind of just ease that whole breathing pattern, because you see their chest will raise. It looks pretty distressing on the lungs and the body. So that's really why morphine is used in those near hours before death, is to help just ease that whole breathing pattern and ease the body. Skin color. So skin color, you will look for really imminent death if you will look for what's called mottling. Mottling is when you look at the toes or the lower legs, and they usually will start to change to this, like, it almost looks like a bruise color, like a bluish, purplish, maybe reddish sort of tint. And the skin color really changes to that. It looks kind of like a bluish reddish, and it makes its way, sort of starts in the toes and makes its way up the legs. So you're looking for that. And then it can also happen actually in the fingernails as well. They can kind of turn a little purple-y or bluey. That's skin color. Cap refill. Do we have a nurse here? I'm wondering if we have a nurse here. I'm just realizing, Mary Helen. Cap refill will be slow, typically just less, because there's less blood flow making its way throughout the body. And that's really why you're seeing those skin coloring changes as well. Other sort of one more start before I move on to Sue. So one other physical symptom that I would really look for is that in imminent death, and when the person is imminently dying, they're really not going to be awake or alert. They're going to be in this really unconscious state of mind. They're going to be really in this like unconscious state. So they really, you can't really wake them up. You can't really arouse them. They're really not really responding to any kind of touch or communication, things like that. So that's what I would look for. Okay. Rhonda, I'll tell you, cap refill. It would be something that a nurse would look for. It's when you basically would basically what you would do is just pinch the fingernail and see how quickly the blood returns to the fingernails. So it's really something that the nurse would be checking and looking for. Sue, okay, can you give me the links to your YouTube sessions? Oh, yeah, Sue. So, actually, if you should be able to, if you actually click, actually, I can't see it on my end right now, but do you see where my little face is? There should be like a subscribe button. If you subscribe to my channel, and Sue, I can get back to you if you don't see it. Squeeze fingertips. So if you don't see, there's like a little circle with my face in it. If you see that and click on it, you can then subscribe to the channel, and then you'll get alerts when I put out videos. Um, and if that doesn't make any sense, I can also talk to you on the side as well. Let me know if you see that or if you have any problems. And Sue, any other, I'm reading that again just a second time. Any other like live Q&A sessions that I'll do, if you subscribe to my channel, then, and you'll just see a little button under my channel. It says subscribe, just click that. If you subscribe, you will get notifications if I'm going to be putting out a live session, or if I go live, you'll see that as well. But I'll usually post it kind of all around the different places. So social media, Facebook, Instagram, all that stuff. Mary Ellen, I thought that was funny. You didn't have to delete that. Squeeze fingertips, squeeze fingernails. That's what it is. Look for blood flow. Look for blood return. All right, guys. Any other questions here? Oh, uh, oh, you've subscribed. Okay, great. Looking for the post. So if you go to my channel, you'll see all those videos, but this is the only live right now. I'm sorry, I'm not sure I actually understand. I'm trying to. Oh, looking for past videos. Yeah, so if you go to my channel, and I can send you a new link to my channel because I know you sent me an email. So I can send you a new link, and you can go there, and you'll be able to see all the videos that I've posted there, if that's what you're asking. I think it might be. Oh, thanks, Adam. So Adam said, I clicked, Sue, I think this is for you. So I clicked get notified on the Q&A post that you put up. So that's how it looks like Adam got notified. So there was the Q&A post, and I think he must have clicked the post, and he was probably signed into YouTube. So if you're signed in and you click the post, you can actually click get notified. So anytime I put up like a reminder that we'll have a live Q&A session, I'll put the link, and you would click the link, and as long as you're signed into YouTube, you can, I think, click that get notified. I think that's what Adam is referring to. Thanks, Adam. Good question, Mary Ellen. So, if our person stops taking food or hydration, will it hasten death or speed up death? So, for the dying person, the natural dying process is to stop eating and drinking. It is not speeding up the dying process, it is a part of the dying process. The dying person is really disinterested in food and fluid. They lose interest, they're not hungry, they're not thirsty. Of course, if they ask for something amazing, if they ask for food or fluid, amazing. Yes, absolutely. Give them what they ask for. But to lose that appetite, to lose that thirst, to not want food, to not be hungry, to not be thirsty, that is really a natural part of the body's shutting down process. And if you think about it, in when the body is really preparing for death, and as the body is shutting down, food and fluid really aren't the priority for the body, because the body doesn't need to keep going and doesn't want to keep going. It's shutting down. And so that is a very, very natural thing and normal thing to see, that the dying person will just be less and less interested in food or fluid. They might even feel like nauseous, like food or fluid might make them nauseous. They might throw up. It's actually like trying to force someone to eat and drink when they are not hungry and when they don't feel good and when they are nauseous. It can actually lead to worsening things like abdominal pain or discomfort. It can lead to things like reflux. And I've actually seen the worst case scenario is if you try to push someone to eat or drink food or fluid when they really don't want to, or their body's not tolerating it. It can actually lead to what we call aspiration, where food or fluid contents kind of go back, kind of get reflux or don't swallow correctly and end up in the lungs. And it can cause respiratory distress. Basically, someone gets really, really short of breath. They have a really, really hard time breathing. You'll notice a lot of coughing. They seem like they're under a lot of distress, and it can even cause really imminent death as well. So that is all about the natural dying process with slowing down of the food and fluid. Very, very normal, common. And when I am with someone who is dying, who isn't hungry, who isn't thirsty, I allow them to really guide me. I think that's a good kind of rule of thumb is just allow them to guide you. And if they want something, if they ask for something, great. But if they're not hungry and they refuse, fine. Um, Great question, Mary Ellen. Okay, I think I see. Okay. Can you speak to the pain level if they choose not to eat or drink? So, Mary Ellen, that's a great question because I'll be honest. So pain is subjective, and I have seen some people experience pain, and I've seen many, many people experience no pain at all, whether they eat or whether they stop eating or drinking or what. I have had so many people who I have seen very easeful and comfortable through their dying process, and not eating and not drinking really does nothing to contribute to any sort of pain level. So it's a great question, and I actually think it's a big misunderstanding, and a big sort of misconception that not eating and not drinking also leads to pain, but it's not actually true, at least in the experiences that I've had. Some people experience pain, some people don't. And whenever I look at someone who is dying, and if they can tell me that they're in pain, then we can respond. But the other thing that I would really think to look for if they can't communicate with you is just looking at their body language. I think that like nonverbal cues are a really great way to help support someone who is dying, who's going through their dying process, when it's like trying to learn a new language. It's like babies, when babies are crying, we try to like everything we can do to console them. Or if they look uncomfortable, we try to console them. It's very similar, I think, with someone who's dying. You are really like reading their new language, and that's their body language. Is their face grimacing? Are they clenching their teeth? Is their body really tense? Are they grimacing? Are they scrunching their eyebrows? Do they look like they are in pain or distress or discomfort? Then we can help treat them that way. But otherwise, it's if they're able to communicate and they appear to be calm and comfortable, and they're not saying they're in pain, then I believe them. It's one of those, pain is such a subjective thing. But I think we naturally, especially because like movies and social media and all the things out there, is like we think that when we die we're in pain. But I have seen, actually, I would say almost more cases than not where people really don't experience any pain at all. So great question. Great question. Okay, let's see. Refresher for me, because it's been 23 years since I witnessed dying process. Things change. Yeah. If you want to find more information, so we have all these different offerings. If you are interested in just checking them out, I've left links below. When I end this, you'll see, or actually you might see it. I can't see it, but in the description, you'll see different links for different things. I have a couple courses out. I've got some books out. I've got other stuff that's soon to be coming out. So definitely just keep an eye out if you're interested. Check them out. I have my newest course, The 6 Most Important Things to Do Before They Die mini course. That was just released about a month ago or so. super quick course that really was me trying to answer the question of, my person is dying, what should I do to prepare? That was really what came out of creating that course. All you need is kind of like 5 minutes a day to get through it. It's really mini, bite-sized little clips of information and tools to take into your situation. And then I've got a couple books out, The Dying Process and Dear Caregiver, It's Your Life Too. So check them out. I left the links below. You can check out my website. I left that link below too. And thank you guys for being here. I will be posting when our next live Q&A will be, and I hope to see you guys soon.